welcome to the very first episode of What You Need to Know. I'm Catherine Dumble, and on this episode, we look at what you need to know about hypertension. Before we begin, it is important to note that there is a whole lot of information to be shared as well as consumed when it comes to the different medical conditions that we are going to look at in this series. However, the information shared on this platform is a general overview. It is basically what you need to know about these medical conditions so that you're able to make informed decisions regarding your health. That being said, here is what you need to know about hypertension. So to start with, you need to know that we have a fluid in our bodies known as blood. Now, blood is also referred to as the fluid of life, and this is due to its importance in ensuring that overall health is maintained. So it's responsible for transporting oxygen as well as nutrients to different parts of the body. It is also responsible for the removal of waste products from the body, and it also has an immune function. So it has these different immune cells that help us fight off infections as well as disease. So for this blood to be transported to these different organs that require it, it is pumped by an organ that we have in our bodies known as the heart. So the heart is basically just a pump that pumps blood. Now, the very fact that blood is pumped by the heart to different organs does not mean that this blood just gushes out after being pumped and gets to the different organs that require it. No. Instead, there exists a network of vessels known as arteries that feed into these different body organs, and it is through these vessels that the blood is transported from the heart to the different organs that require it. So, what is blood pressure? Blood pressure is a product of how much blood is pumped by your heart and how much resistance the blood faces in the blood vessels before it gets to the different organs that require it. Simply put, it is the amount of force that your blood exerts or puts on the blood vessels as it travels throughout the body before it gets to the organs that require it. Blood pressure is recorded as a fraction. So there is one figure on top over another figure at the bottom. So if the heart is a pump and it's constantly pumping blood, so it is contracting and relaxing. It's contracting and relaxing. It pumps, and before it pumps the next time, there's a period of what you might want to refer to as rest. So it pumps and rests, and pumps and rests. So the figure at the top or the figure on top represents the maximum amount of force that blood exerts on the blood vessels in the period when the heart is actually pumping or contracting. The figure at the bottom represents the minimum amount of force exerted on the blood vessels by blood during periods when the heart is resting before it pumps again. Now, there is what is generally accepted as normal blood pressure. The importance of maintaining your blood pressure within normal, or at least as close to normal as possible, is, among other things, to ensure that adequate blood is transported to the different parts of your body in order to sustain life. Now, because human beings are not all the same, there are different factors that make us different and that determine what one set of people, one group of people, or one individual and another have as their individual normal blood pressure. Normal blood pressure is not just one set of figures, rather it is a range of values. So there are different categories of normal blood pressure. If your blood pressure is measured and it is found to be higher than what is accepted as normal, then you are said to have a high blood pressure. People with hypertension have a high blood pressure. Now, it is not always that your blood pressure will be measured and it is found to be higher than normal that you actually do have hypertension. Here's why. Sometimes a raise in your blood pressure could be your body's way of responding to stressful situations. Some people's blood pressure could increase when they are in pain, when they're anxious about something, or when they see healthcare providers. Some people have received more bad news than good news from healthcare providers. So every time they see one, especially those wearing white coats, they tend to get anxious, and therefore their blood pressure tends to increase. For such people, it could just be a once-off thing, and once they cool off or calm down, their blood pressure comes back to normal. That does not mean that they're hypertensive. What then is hypertension? Hypertension is a sustained raise in or elevation in blood pressure. So when your blood pressure is measured on more than one occasion and it is found to be higher than what is regarded as normal, that normal range, those different categories of normal, when it is found above that range of values on more than one occasion, then you are regarded as hypertensive. You have hypertension. Now, it is not fully known or understood what causes hypertension. However, it comes about as a result of three things. Number one, it is due to the constriction of blood vessels. Number two, it is due to the retention of sodium or salt in the body. And number three, it is due to the retention of water in the body. So under normal circumstances, the body has mechanisms in place to ensure that blood pressure is regulated or maintained within normal ranges, or at least as close to normal as possible. So there is what is known as the RAS, or the renin-angiotensin-aldosterone system. Now, this system is activated when your blood pressure is detected to have fallen below normal ranges. So the normal thing to do, if your blood pressure has fallen below normal, in order to bring it back to normal, or at least as close to normal as possible, is to increase it. So once it is detected that your blood pressure has fallen below normal, this system is activated. And through a series of events, one thing leads to another, and to another, and to another. Ultimately, what happens is that number one, your blood vessels are constricted. Once your blood vessels constrict, your blood pressure is increased or raised. Number two, sodium is retained. So under normal circumstances, or when your blood pressure is within normal ranges, sodium is supposed to be excreted via the kidneys. Now, when your blood pressure is low, sodium tends to be retained within the body. And this is because sodium has a tendency of drawing fluids towards itself. Now, an increase in the blood fluid volume translates into an increase in blood pressure. So if sodium is retained and it draws water towards itself, that leads to an increase in blood fluid volume, thereby leading to an increase in blood pressure, increasing it from being low to being normal. Now, once we get to normal blood pressure from being low, it means that this system is supposed to shut down. However, there are times when instead of shutting down, this system remains active even when normal blood pressure is attained. So if our goal is to increase blood pressure from being low to being normal, but instead, even after getting to normal values, we still continue carrying out activities that are increasing blood pressure, what we're doing is we are elevating the blood pressure from being normal to now being abnormal, because it goes beyond what is normal. And as a result, the heart begins to work harder and faster. That's how hypertension comes about. There are things that put you at risk of developing hypertension, and these are referred to as risk factors. So these risk factors are divided into two categories. There is a category of things that you cannot do anything about, and these are referred to as non-modifiable risk factors. And then there is another category of things that you can do something about, or you can change them, and once you do, your risk of developing hypertension is significantly reduced or even done away with altogether. So the non-modifiable risk factors include your age. Your risk of developing hypertension increases the older you grow, and it is highest in people who are older than the age of 60. However, it's actually a more common form of hypertension, which is referred to as primary hypertension. It is referred to as primary hypertension because it just begins on its own, and it is seen even in patients who are younger than the age of 30. But for people who are older and they develop hypertension, it is usually because it presents as a complication of an underlying medical condition, or a medical condition that's already existing, and hypertension results as a complication of that medical condition. Number 2, your gender. So hypertension is more common in males than it is in females. Number 3, your race. Hypertension is more common in what people like to refer to as the black race, other than any other race. Number 4, family history. So you are at risk of developing hypertension if you have a family member who actually does have hypertension or is hypertensive. These are non-modifiable risk factors because there's nothing you can do about them. Now, the modifiable risk factors, those that you can do something about, include number 1, stress. Number 2, a sedentary lifestyle. If you work in an office, you prefer taking the elevator as opposed to the stairs, you rarely do exercise or hardly ever do exercise, you're at risk of developing hypertension, but you can do something about that. Number 3, obesity. Number 4, salt intake or high salt intake or salt consumption. Number 5 is excessive alcohol consumption. And number 6 is smoking. These things put you at risk of developing hypertension, but these are things that you can do something about. These are things that you can change, and once you do, you significantly reduce your risk or the chances of you developing hypertension. One of the most important things that you need to know about hypertension is that it is also known as the silent killer. I repeat that. Hypertension is also known as the silent killer. And that is because the majority of people who do have hypertension actually do not know that they actually do have hypertension. And that's because they do not have symptoms. But when they do, the sure sign of hypertension, or what increases your healthcare provider's suspicion of the fact that you could have hypertension, is an elevated or increased blood pressure, or a blood pressure that is higher than normal. That is the sure sign that actually increases your healthcare provider's suspicion of the fact that you could have hypertension, or the indicative thing actually of hypertension. Other than that, patients could have headaches. Now, these headaches are usually occipital or at the back of the head, and oftentimes they start in the morning and they tend to go away as the day progresses. You can also present with, you can also have shortness of breath. You can also have dizziness or lightheadedness, or you can have blurred vision or double vision. You can also be easily fatigable. So these activities that normally wouldn't get you tired so easily begin to tire you out real quickly. These could be symptoms of hypertension. Also, your heart is constantly pumping blood. That means your heart is constantly beating. But it is not normal for you to feel your heart beat. You're not supposed to feel your heart beat, even though it is always beating. So once you begin to feel your heartbeat, that's an abnormality, and it could be a symptom of hypertension. These are some of the symptoms that patients who are hypertensive actually have or present with. So the right time to visit a healthcare facility is anytime you experience any of the symptoms that we have just discussed. However, Because hypertension is said to be a silent killer, and people who have elevated blood pressure or actually even hypertension may not have symptoms, it is advisable for you as an adult who has known normal blood pressure. So you know that you have normal blood pressure because constantly it has been normal. It is advisable for you to have your blood pressure checked regularly, at least every 2 to 5 years until you turn the age of 80, just to ensure that you have not developed hypertension or it's not caught too late. So once you visit a healthcare facility, you expect to be asked questions, number one. So the questions that your healthcare provider is going to ask you is just for them to generate information, to give them an index of suspicion for something that you might have, or whether to give them a suspicion for maybe hypertension or anything that you might have. Number two, you expect your body to be examined. So your healthcare provider is going to carry out a focused physical examination on you. This is going to include them examining your eyes. They're going to listen to your heart using a stethoscope. They are going to actually measure your blood pressure too, and do a few other things in order to either increase or decrease the index of suspicion for something, which even includes hypertension. Number three, if it is found that your blood pressure is high, dangerously high, just like there are degrees of or categories of normal, there are also categories of abnormal. There are certain people whose blood pressure will come dangerously high, and you don't need to ask them to go back home and come back later. So for some people, their blood pressure will be so high that you want to check if this high blood pressure has actually has been there in existence for a long time. Has it caused any organ damage, or is it as a result of something else or another medical condition, or is it existing alongside another medical condition? So in order to determine all of these things, they will carry out tests on you. So they might carry out blood tests. Among other things, what blood tests are going to do for them is that they are going to show them if your organs are receiving sufficient blood. Also, blood tests might show if your kidneys are still functioning as they should, among other things. They might also carry out urine tests on you. Mainly urine tests are just for them to check if your kidneys are still functioning as they should, among other things, obviously. They might also do imaging on you, imaging tests. So they might want to do a chest x-ray if they think that is necessary. They might also do what is known as an ECG, electrocardiography. They might also want to do echocardiography on you. Those are just examinations to check or to assess the structure and function of the heart, to see if there are any complications to the heart. Has the hypertension been long-standing that it has caused damage to the heart? So yes, that's the information that they're going to obtain from the investigations or the tests that they're going to carry out on you, if they deem necessary to carry out such tests. When it comes to the management of hypertension, there are two main treatment options. The first one is the non-pharmacological treatment option, and this one does not involve the use of medication or drugs to manage hypertension. The second one is the pharmacological treatment option, and this is the one that involves the use of medication or drugs to manage hypertension. So the non-pharmacological treatment option is simply you regulating or working on those modifiable risk factors we spoke about when we spoke about the factors that put you at risk of developing hypertension. So this involves things such as managing your stress. This involves things such as limiting your salt consumption. This also involves not consuming added salt at the table. So ensure that your salt is added to your food as the food cooks, and do not add any more to the food at the table as you eat. Number three, you also want to incorporate exercise in your life. If you live a sedentary lifestyle, you want to make sure that you incorporate exercise in your life, but ensure that this exercise is not beyond what your body can tolerate. Number 4, you also want to manage your weight. There is weight that is there is acceptable weight rather for a particular height. So you want to know how much weight is acceptable for your height and work towards that. You also want to limit your consumption of alcohol and cease to smoke if you do. This is the non-pharmacological treatment of hypertension. When it comes to the pharmacological treatment or the use of medication and drugs, or the use of medication or drugs to manage hypertension, it focuses mainly on 4 categories of drugs. There are 4 categories of drugs that are used to manage hypertension. So remember how hypertension comes about. So these drugs are mainly just there to counter what causes hypertension to actually arise, or how rather hypertension actually arises. So remember when we spoke about the RAS and how through different events, one thing leads to another, that cascade of events that ultimately leads to an increase in your blood pressure? There are categories of drugs among these 4 that target points in that cascade of events to ensure that your blood pressure is not raised. We also said an increase in the blood fluid volume results in an increase in blood pressure. So there are drugs among these 4 categories that are responsible for taking out fluids out of your body, because we say if sodium is retained in the body, it withdraws fluids towards itself, thereby increasing the fluid volume and increasing your blood pressure. So if we're going to reduce your blood pressure by targeting the fluids, we want to remove the fluids from the body. So there are drugs that are responsible for doing that. And we said when all these things happen and your blood pressure is increased, your heart begins to work harder and faster. So there is also a class of drugs that ensures that is responsible for ensuring that it works on the beating of your heart and calms your heart down. So these are the different classes of drugs that are available to treat hypertension, and you may be put on more than just one drug. And once you are put on antihypertensive drugs, it is advisable for you to take these drugs. You might need to take these drugs every day for the rest of your life. The reason why you're taking these drugs is to avoid complications of hypertension. So you are not advised to at any point stop taking your drugs. Every drug has side effects. So if you develop side effects, which are definitely going to be discussed with you before you are put on medication, if you experience some side effects and they are too disturbing, you are advised to go back to the healthcare facility, and you'll be guided by your healthcare providers. You're not supposed to stop taking your antihypertensive drugs because they are giving you side effects, or because you just don't want to take them and you're tired of taking them. So you continue taking your antihypertensive drugs every day for the rest of your life from the time that you begin to take them. You take them every day for the rest of your life to manage your hypertension, because once you stop, your blood pressure skyrockets and it results into complications. And up next, we're going to look at the complications of hypertension. So if left untreated, whether it is because you did not know that you were hypertensive, or you actually did know that you were hypertensive, but because of one reason or another, you decided not to adhere to treatment, then complications of hypertension may arise. Now, complications of hypertension usually manifest in, number 1, the central nervous system. So you might develop seizures, you might develop dementia, you might also develop strokes. Now, strokes could either be ischemic or hemorrhagic. So ischemia is simply temporary loss of blood supply to parts of the brain because of the pressure at which the blood is being pumped. There could be inadequate blood getting to the brain. Hemorrhagic stroke is as a result of a rupture in the blood vessel that takes blood to the brain. So it means after where the rupture is, parts of the brain, distal or further, will not receive blood supply. Therefore, that will be referred to as a stroke. That's hemorrhagic. The former is ischemic and the latter is hemorrhagic stroke. You might have eye manifestations due to a series of events, one thing leads to another and another and another, you might gradually lose your eyesight. When it comes to the heart, you might develop different cardiac complications that ultimately will lead to heart failure. And hypertension also targets the kidneys due to, rather through a series of events, you might ultimately get to a point where you lose kidney function. These are the complications of hypertension, the key ones that you need to know among a lot of other complications, but these are the main ones that you need to know about. So in order to prevent hypertension, in as much as there's nothing that can be done about the non-modifiable risk factors, prevention simply involves working on the modifiable risk factors, the stress, the alcohol consumption, the salt consumption, and all of those things. That's what it entails in order to prevent or at least delay the onset of hypertension. Now, you also need to be adequately hydrated. However, remember that friend that says water is the solution to all problems. So you're sick, you have a headache, just take water. What problem do you have today? How are you feeling today? Just take water. Water is the solution to all problems. That, however, is not the case when it comes to hypertension. Remember, we say that an increase in blood fluid volume ultimately leads to an increase in blood pressure. So when you have a headache, it is not always that you have to take water, because your headache might actually be a symptom of hypertension. It might be notifying you that you could be hypertensive or your blood pressure at that time could be high, and what you need is not water. What you need is interventions by healthcare professionals. So that is why it is not advisable to self-medicate. Remember, it is the same water that when boiled will soften a potato but harden an egg. So water is not always the best of solutions. Seek healthcare guidance, seek medical attention whenever you experience symptoms, any symptom, whenever you're in pain, whenever you experience any symptoms, avoid self-medicating and seek medical attention. That's all we had for you where hypertension is concerned. I'm glad to have had this discussion with you. It is my hope that you found it edifying. Thank you for having joined us on this episode of What You Need to Know, on which we were looking at what you need to know about hypertension. If you have any questions, be sure to leave them in the comments or send us an email to the address on your screen. Until next time, take care of yourselves and take care of each other, because we do care about you. Goodbye.